So, how do you think that regulators' policies and standards coming out of this could change moving forward?
Well, unfortunately, it's always been that big football that's been kicked into the grass on many, many occasions. I mean, we've had that many green papers, white papers, and all the rest of it, but no actual action. And the government currently has talked about grasping the nettle around elderly care, but I've never seen anything come from it. We've had various reviews, commissions, and what have you that have come out with suggestions, but they are all they have two fundamental issues. One is they cost, and secondly, they are often political suicide because you're having to challenge that part of the population who are going to have to make some very, very difficult choices about their lifestyles. And, if you're not popular, you will not get voted for. And that has been one of the major issues for governments of whatever colour they might be. Um, but I do think you will see market forces taking over. I mean, one of the big issues we've seen recently has been an increase in the retirement village concept, which actually is very interesting because I think they are offering a genuine better way forward. Typically smaller accommodation, often very expensive. So you maintain your resource, so to speak, you maintain your capital and equity, but you are then releasing, let's say, a four-bedroom house for redevelopment for a family, and you're moving into a more American style community living where you have lots of things that would help you, such as canteens and restaurants, facilities and features outdoor space and so on and so forth. And those have actually done very well in the COVID environment because that community has been able to form a bubble, and that community has been self-contained, and that community has had support. Whereas I know a lot of elderly people have felt very isolated during COVID because they've had to lock down in their own house. Their relatives often maybe a long way away, or can't interact with them because of the risk of spreading COVID. So actually, that solution has come out, I think, at a really nice time.
Really interesting point you make, and we've seen that some of the hotels are starting to shift their operating model to start going
Yep.
to providing some of. We compare the UK to the US. The challenge we have predominantly is the space of land that we
Mm,
have
mm.
available to us. So it'd be interesting to see whether the hotels can enter this market and fill that gap. I know we've been talking a bit about cost based already, but how would the COVID impact? What does that do to profitability of the sector in face of high debt leverages in many companies?
I think the first one, it is compressed margins for all the reasons we've said. We've had reduced income, not just fees not maybe moving in the way that they should be, but also occupancy obviously declining quite dramatically. You've had increased costs. I mean, a lot of care homes were absolutely taken to the cleaners around personal protective equipment, certainly in the first quarter of of the COVID crisis, say from March through to around June or July, where they were just paying out for things at 10 times the price that they should have been charged. You've also had, obviously, I mentioned staffing costs, both costs of having to pay staff who aren't working because they're shielding or they're off because they're sick, and also having to bring in additional staffing, agency staff, and so on and so forth. And I think you've also seen there that that has not bounced back. So you've not seen people coming into care homes during the crisis generally, partly because they've either not been allowed to legally, they've not been allowed to come into a care home, or they're feeling concerned. They don't want to come into a care home because of the risks that they perceive. And that's unfortunate, really, because, you know, the initial COVID issues within the care homes were not of the care homes making. They were largely of the making of the NHS, who took people out of hospital untested and put COVID into the care home sector where it ran rampant, really. But for investors, I think it is asking quite a few of them to really reevaluate what they want. The good thing about any discontinuity in the market is there are opportunities. Now, you have to be an investor which is prepared to take that on. So I have seen many investors who really have struggled with COVID, thinking that care homes are all very easy and lovely and no problem at all. And others have actually said, here's an opportunity to consolidate, here's an opportunity to buy in, here's an opportunity where we see the market supply contracting, but the demand remaining the same. Therefore, hold it for a couple more years, and things should move in a better way.
So if you enjoyed this content, please don't forget to like, share and subscribe for conversations just like this.